Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Smita, board-certified plastic surgeon in New Jersey, and I'm here with Ashley, my co-host, who's up in Rochester, and we are continuing our series on top 3 things you need to know, and we're sort of breaking down all of the big plastic surgery procedures. I think it's so important to sort of filter through all the noise and really focus on the 3 things that you should really learn about, consider, talk to your surgeon about before considering these procedures. So, Ashley, what are we going to talk about today?
So this is always a top topic for us, and we know our listeners love it. We are talking about breast augmentation today. So the top 3 things that you need to know about breast augmentation. So we're excited to dive right in.
Yeah, this is going to be a good one. I mean, I think our breast augmentation episodes get so much views, so many views, right? And it's such a popular procedure. It's always in the top 3 nationally. So we're going to break it down, and we're going to start with number 1. Let's just dive in. What is our number 1 thing to know?
So I love telling patients that if you're having a breast augmentation, the most important thing to know is that it does not have to look fake. Because when we think about, the way breast augmentation has been stigmatized, we always think it's big and raunchy and overdone. And that could not be farther from the truth. And I think that's kind of what our aesthetic is. A breast augmentation can look so gorgeous and so natural that no one has to notice if that's what you want. But if you want a big, bold breast augmentation, we can do that too. It's such a huge gamut. Would you say the same?
I agree. I mean, I think there's so many patients that come in that have been thinking about it for so long. They've been unhappy with the size of their breast, their shape, how they fill out clothing, but they don't want that unnatural, fake, augmented look. And I often tell people, a lot more people have breast augmentations than you might know just because it looks so natural.
Right.
What did I see? I saw someone posted, one of our colleagues actually posted on Instagram, if you see a picture of a breast aug and you're thinking to yourself, oh, where's the before, then it's unnatural, right? Because you should really have no idea that there is even a before picture because it looks normal.
That's really cool.
So, yeah. I forget who said it, but I remember making a mental note when I saw that. But I think that's the thing. That's the key. Really just natural is important to our patients, and we can certainly provide that with breast augmentation, but really any procedure that we do.
Yeah, absolutely. I think that's exciting to know because we just hear about all the overdone, all the bad things, all the botched cases that you see on TV. But the reality is that there's probably tons of people that who have breast augmentations and you don't even know that they do because it looks great. It just fits their body. It is absolutely achieving their goals, and we are more than able to do that for you if that's what you're looking for. So don't be intimidated thinking that breast augmentations are fake looking. They definitely do not have to be, and that's really, really exciting, and definitely the number 1.
Definitely the number 1.
Yeah, what do you think about number 2? What's the number 2 thing that we need to tell patients about breast augmentation?
I think with number 2, it sort of ties into number 1, right? I think, so our body dictates the size of the implant for the most part, right? So, a lot of that augmented look, that fake, overly done look is really when you're sort of stretching the limits of what our body is sort of dictating for us, and you're putting in implants that are way too big, which, in the short term, if that's your aesthetic, looks great, but in the long term can really cause some real consequences to the quality of your skin. So,
that's so important.
It's so important. I have all these little analogies. So I always tell patients, it's like a manila envelope, right? I mean, you can stuff a huge stack of papers in there, and our breast tissue doesn't tear like the envelope does, but it sort of does over time. Whereas if you put in a stack of papers that fits just right, it's perfect. And so our breast has dimensions, it has dimensions, the implant has dimensions. And so as long as they sort of work hand in hand and fit, you're always going to have a good result and a natural result.
And there's a range of implants that fit in your body too. You know, just because the implant fits in your body, it doesn't mean it has to be really discreet and very natural looking. If you want something that's a little bit more bold, we can still totally do that within the confines of your body. So the breast, the breast implants come in so many shapes and sizes and different projections and things like that. So that's why you come to us, because we know all the options that are out there, but we want to achieve your goal, but we want to keep it within a range that's going to actually fit in your body, and that's going to give you the safest result, the best long-term result, and you're going to be grateful that we sort of guide you in that path. But there's a huge range, so whatever it is that your goal is, we can do it safely. We just have to make sure it's the right kind of implant that's going to fit into your body.
Right.
So just important to know, because I don't think anyone really comes in thinking about that. And when we take measurements, I think a lot of people are like, what's happening, But it's really important, and I think that a really good plastic surgeon is going to really focus on those things and help you understand that when you're picking an implant.
Right.
And so we jump into number 3. So
yes, number 3.
So breast implants are not a lifelong device. Just like any medical device, they are man-made. And so there is always a chance that when you're putting in an implant, that's not going to be the same implant that you have until you're an old lady, because it's a device, and all devices have the potential to fail over time. And so you just want to mentally go into breast augmentation, especially if you're a very young person going into augmentation, knowing that you're probably not going to have that breast implant for the rest of your life. And so there will be revision surgeries or exchanges or different things that come with time as you age, as your implant ages, as your breast ages. So you just want to mentally prepare for that it may not be, and it probably won't be, a one and done.
Yeah, I think that's so important, because I don't think, a lot of people don't talk about that. So you don't really, you sort of go in, you're like, okay, I'm going to get my breast augmentation and I'm sort of done, but it's not a one and done.
No.
They're man-made objects, and so there's going to be wear and tear on them, just like there is everything else. And our body's constantly changing, like you said. So I always tell people, just prepare that you're going to need something down the road, and it may not be the 10 or 15 years that traditionally we think of when we think of the lifespan of an implant. It can last much longer than that, but it also depends on what your body is doing, what that implant is doing. So just be prepared to know that you're going to need something done 9 out of 10 times.
I think it's just important to talk about, because I think a lot of people just think they're going to get it done and then that's it, and that's their breast for the rest of their life. So I think that your surgeon, should be forthcoming about that and really have candid talks about breast implants, because yes, they're safe, but there's a lot that you need to know about that, and that's why you need to see a board certified plastic surgeon, so you guys can really have a good discussion about what having an implant really means and what the long-term needs are if you have a breast implant. So we always have those conversations. I know that the both of us do with our patients, and that's something that you definitely want to talk to your doctor about during your consultation.
Right. And, you brought up a good point, right? It's important to know that up front, because oftentimes, right, this is all plastic surgery is cosmetic surgery. There's a price, there's a cost to all of this, right? You're paying for your surgery, for whatever else. And so that's something to always think about. It's not just a one-time deal. Any sort of revision that also incurs some sort of fee, or cost for whatever it is, whether it's new implants or whatever the case is. So, you just want to prepare yourself for sort of knowing, like, it's none of it is covered under insurance at any point. So just something to keep in mind, You
just be responsible about it. This is a very adult decision to decide to have cosmetic or aesthetic surgery, and you just want to be really responsible about what that means, not just now for that instant gratification, but long term.
Right.
And we'll help you as you're making those decisions. But just something to think about. And just be really honest with when you're discussing and planning for your breast augmentation, which is exciting and fun.
Which is super exciting. And this is one of those procedures where, you literally wake up and you have the breasts that you want.
It's
There's
done.
fine tuning and healing, but you've got the bigger breasts. You can show them off in your clothing, bikini. So happy patients overall. But
Yeah.
these 3 things, knowing the top 3 will really just sort of set you up for success as you're on your journey to get your breast augmentation. And we're super excited about this series. There's a lot more down the road that we're going to be filming and posting. So subscribe to Lipstick and Lipo, YouTube, and listen to us on Spotify on your commute so you don't miss anything. We've got so many great things happening in the future.
Bye,
So,
guys. See you soon.
Totally fun. I'll see you guys soon. Bye.
Bye.